everyone, this is Learn, Lift, Repeat, and we are back with another video.
And today we're going to go over the scapula and the clavicle.
But before we get started with these two very important bones of the upper limbs, we're going to discuss the answer to the question we proposed in our previous video, which was, what is the one bone in the upper limb that is most vulnerable to fractures in adults?
Yep.
And the answer to that is the distal radius, which makes up your wrist joint.
Yeah.
All right.
And the story behind that, we actually had someone we know very well just go ahead and fall down and fracture their distal radius. And you know what? If you don't address that right, now their bone is just protruding out kind of, and like they can't even pronate and supinate properly. These are some, we'll get into it later. But
well, medial rotation is known as pronation, and your lateral rotation is supination.
Yeah.
In simple terms. But now that we have that out of the way, we can get started with the very important bone in the upper limb known as scapula.
Scapula.
And the scapula is the bone that you can kind of feel protruding out in your back. If you try flexing your back a little bit, it's like that one bony triangular shaped bone. And let's talk about the three borders of the scapula. So the border that is on...
There's a medial border. So I'm talking about the right scapula. So you can just, this is anterior. We got like the chest, the ribs and stuff, but behind the ribs.
So if you try and envision the scapula from the posterior end, and then once again, we'll post another video showing the diagram of the scapula, which will definitely make things clearer. But if you see the scapula from the posterior end, and the right posterior scapula.
Okay, so this is what you would see. You would see like a bone with a medial end right here, and then you'll see a superior head right here. Not a head, but superior border.
Yeah.
And then it's not a square. So from here, it just goes like this. It's kind of like a 45, it's a little bit of a 45-degree angle with a curve, but that's kind of the scapula for you. And it's resting on in the back of your ribs. So basically the three borders of the scapula are the medial border, the lateral border, and the one that's on the top, the superior border. Yeah.
And with that, the scapula is also, it kind of has three divisions to it. One of the very important features of the scapula is something that passes along a little bit on the superior side of the scapula and is known as the spine of the scapula.
Yeah, something that we all have.
Something that we all have, and apparently one of our bone also has that.
Yeah.
So it's known as the spine of the scapula, and the spine of the scapula divides the scapula into two regions, superior and inferior.
And like the three borders, there's also three processes that there are in the scapula. And as discussed previously, we have the spine, and coincidentally, one of the processes is called the spinous process.
So the spinous process lies on the spine of the scapula. And then you have two more important processes.
Yeah. I personally like this process because it reminds me of Pokemon, but it's called the acromion. Pokemon, acromion, kind of rhymes together, but
a little bit.
It's the acromion process.
Okay.
And the last one is the coracoid process. And personally, I'm not a fan of coracoid process or any of the processes that start with C. There's a whole lot of them. And if you guys stay along and you guys are watching us, you find out. But
I guess the names of those processes can get confusing. But the important thing to know is that the coracoid process is a little hook-shaped process here on the superior and a little bit superior lateral. And then on the more lateral end to it, you'll see a big acromion process. And these serve as attachment with another bone that you see here, also known as a collarbone, which is also known as a clavicle, which we're going to talk about later.
Yeah. Okay. So, like I was saying earlier, the scapula, it's on the back of your ribs. So, the anterior surface of the scapula goes ahead and lies against the ribs.
Do you want to talk about the three different fossas as well?
You can go ahead and talk about it.
Okay. So the three different fossas, they're very easy to remember, I would say. So we all know that the scapula has a spine of scapula, right? So on top or on the superior aspect of the spine of scapula, you have a fossa known as a supraspinous fossa. On the inferior to the spine of scapula, you have infraspinous fossa. So these are the two fossas on the posterior end. And then you have one fossa on the anterior end that lies against the ribs, and that is known as the subscapular fossa. So these fossas, they help with, again, what is a fossa? They are sites for attachments, right? For something to pass through. or anything regarding that.
1, 2, 3.
Oh,
So-
we're forgetting an important one.
Yep.
Yep, you talked about
Yeah,
that.
you haven't talked about this one, right?
Yeah.
Yeah. So there's not 3, there's actually 4. And this fourth
My
fossa
bad.
is actually very important. It's called the glenoid fossa. And this glenoid fossa, it articulates, joins with, if you watched our previous video, you would know, but it articulates with the head of the humerus. So it's a very important fossa.
Yeah, and that is the glenoid fossa is on the lateral aspect of the scapula.
Mm-hmm.
Again, when we say articulate with, it joins with the head of the humerus. Humerus is again this long bone in the upper arm.
Yeah.
And
There are also divisions within the glenoid fossa.
yep.
There is, well, on the superior end, it's called the supraglenoid fossa. And
The tubercle.
yeah, sorry, not fossa, tubercle.
Mm-hmm.
Yeah, this fossa turns into a tubercle.
It-
It has
doesn't
tubercles.
necessarily turn into tubercle. Yeah,
It has tubercles.
It has tubercles.
Yeah, it contains tubercles, not
Yep.
turns it. Yeah.
Yep.
Anyways, and the inferior aspect is going to be called the infraglenoid tubercle, and these tubercles are very important, especially if you like working out. If you look on
They're
the superior
important
side.
regardless. If you like or not like working.
I mean,
I'm sorry, I have to say that. Okay.
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 I
They're
was-
important regardless,
yeah,
but you were trying to make a point, so I'll let you make that
I
point.
was trying to make my point.
Yes.
These are actually one of my favorite tubercles because they give rise to
Uh-huh.
my favorite
Muscle.
muscles.
Yep.
Not muscle.
And I'm pretty
muscles.
muscles, and I'm pretty sure at this point anybody could probably take a guess if you've been watching our videos and his reels. His favorite muscle is the bicep.
Wrong.
No?
My favorite muscle is the tricep.
Well, both, right? Because you said it gives muscles.
Yeah,
plural.
my two favorite.
Yes.
My most favorite is my tricep.
Okay.
The second favorite is the bicep.
Right, because the majority of your upper arm is made of tricep.
Yeah, 2/3 of your upper arm is the tricep, and then 1/3. Just extra information you don't need to know. Maybe you do.
It's good to know.
Yeah, it's just general knowledge you should know.
Yeah.
But basically, the supraglenoid tubercle, it gives rise to the long
It
head.
isn't right. It touches.
Yeah. All right.
Alright.
It attaches. It attaches the long head of the bicep, not the short head. That comes from somewhere else we'll talk about later.
Yeah.
Okay, like I was saying. So the long head of the bicep, it goes ahead and it attaches to the supraglenoid tubercle, and the long head of the tricep, it goes ahead and attaches from the infraglenoid tubercle. And
Yep. So again, when you start talking about the muscles, we'll see how the biceps, they have a long head and a short head, and that is what we mean by that. The long head of the bicep, it attaches to the supraglenoid tubercle, that is present in the glenoid fossa.
is there a long
Of
head
the
in it?
scapula.
No, there's a long head of the tricep. Is there a long head of the short head of the tricep?
I don't remember.
Yeah, I don't think that we went over a short head of the tricep. I know short head of the bicep 100%,
Yeah.
but
But if there is, we'll definitely get back to it when we start talking about muscles. But right now, not to go off topic, we're just like focusing on the bones. But the short head of the bicep, I just remembered, so I'm just gonna say it out loud. The short head of the bicep attaches to the coracoid process of the scapula. So one of the important processes that we talk about. That's why these processes and these tubercles, they're so important because they serve as an attachment site for a lot of different ligaments, bones, formation of a lot of joints,
yeah.
muscles.
So
Okay.
in short, let's just go over the scapula one more time. Everything we've said for the
Let's-
most part.
Conclude
So-
the scapula. Okay.
Yeah. Okay, so let's just go ahead and summarize the whole scapula for you. This is just like a very basic outlook at it. So obviously first we have the borders, the medial, the superior, and the lateral. And these are the borders of the scapula. Then we have a spine.
Yeah. Then we have the three. We have the three divisions of the scapula. You have the spine of scapula. Anything on top of the spine of scapula is the superior division, and then you have the inferior part. And we talk about three different processes of the scapula. Firstly, being the spinous process that is present on the spine of scapula. Then you have the coracoid process, that is a little hook-shaped process, and then you have the acromion process, that is also kind of lateral to it in a certain way.
Yeah.
Yeah.
And the anterior surface, it's resting against the ribs.
Yeah, and the three different fossas. I'll let you talk about those.
And the 4 different fossas, we have the subscapular fossa, we have the supraspinous fossa, infraspinous fossa, and fourthly, the glenoid fossa.
Yeah, so just for context, the supraspinous and the infraspinous, are on the posterior. The two fossas found on the posterior aspect of the scapula. The subscapular fossa is on the anterior aspect of the scapula that lies against the ribs, and then the glenoid fossa is on the lateral aspect that attaches to the head of the humerus.
I don't know if we talked about anterior, posterior. Well, maybe, but basically, scapula. Behind it, this is the posterior, and this is the anterior. So
Yep.
just
The
in
anterior is
case
the
you don't
front.
understand.
Anterior is the front, posterior is the back.
Yeah.
Yeah, in layman terms. So, and lastly, the glenoid fossa is divided into two different tubercles. The superior aspect, you have the supraglenoid tubercle. The inferior aspect, you have the infraglenoid tubercle. And they serve as very important attachment sites for your long head of the bicep and the long head of the tricep, respectively.
Yep. So that's the scapula for you guys for now, and we're gonna go ahead and move on to the clavicle.
Clavicle. And clavicle is not half as bad compared to the scapula. I mean, it doesn't have too many things to,
One thing I
no.
saw, one of my first observations about the clavicle was, it's a curvy one. It's a curvy little bone.
Yep, it's a little, like a little S-shaped bone. A little bit of an S-shaped bone, not
Yeah.
too S.
It's just a slight S. Not too curvy, but
Yep.
enough for me to notice.
So your scapular bone is on the posterior aspect, right? It's in your back, and the clavicle is on the anterior end.
It's a little collarbone.
Yep. So that's the collarbone that you keep referring to. So the first thing to know about the clavicle is its attachments. So on the lateral aspect, the clavicle attaches to the acromion process of the scapula. So that is one important attachment site between the clavicle and the scapula. So laterally, the clavicle connects to the scapula by its acromion process. Medially, it attaches to
The manubrium.
the manubrium. So that is the,
Chest bone.
not the entire chest bone, the top part of the chest
Yeah,
bone.
like right here.
Yeah, so the top part of your sternum is known as the manubrium, and the clavicle attaches to that manubrium right here on the medial aspect. And I think one and the only important feature of the clavicle is that you have a bony outgrowth a little bit on the lateral inferior aspect of the bone. So, I mean, if I had the bone, I'd kind of rotate it and help you visualize it. But for now, you just have to know that on the lateral inferior aspect of the scapula, you have a little bony protruding, and it's known as the conoid tubercle. And what does the conoid tubercle do?
Yeah, so the conoid tubercle, it actually attaches a ligament, and this ligament is called the coracoclavicular ligament. Coracoclavicular ligament. And this ligament, it attaches basically the scapula to the clavicle. Hence the name coraco. Well, the
Coracoid process.
Coracoid process.
Yes. So, just to reiterate, the conoid tubercle is present on the lateral inferior end of the clavicle. It attaches a very important ligament known as the coracoclavicular ligament, and this ligament helps with the attachment of the coracoid process of the scapula to the clavicle.
Yeah.
All right. What else? So a few more important aspects of the bone, something that you should know. The medial end of the clavicle is known as the sternal end because it attaches to a part of the sternum or your chest bone. The lateral end is known as the acromial end because it attaches to the acromion process of the scapula. And the length of the bone is also again known as the shaft. And along the shaft, on the inferior aspect, runs the subclavian groove, which attaches your subclavius muscle.
Yeah. We'll get into the muscles later.
Yeah.
Right now, we're just bones.
Yeah. And also on the medial aspect of the clavicle, you see a tuberosity known as a costal tuberosity. So again, with the bones, it's just very important to know the different little processes or outgrowths and what their different names are. So yeah, you have a costal tuberosity on the inferior aspect on the medial end. On the inferior aspect on the lateral end, you have a conoid tubercle. On the inferior aspect, running along the shaft is the subclavian groove. Okay, and yeah, that covers everything for the most part.
All right, so we have come to an end, and like always, we're gonna go ahead and leave you guys with a question. And the question is,
yeah, I know the question. Okay, the question is, which bone do you think people break most often, your clavicle or your scapula?
that's it. That's a very simple question. It should be pretty easy. It's a 50-50. Even if you want, you can go ahead and guess one or the other in the comments.
Yeah, so
You might get it right.
You might get it right. There is no surprise or no gift for getting the right answer, but it's
Or
still...
the wrong answer. There's no punishment if you're not your teachers.
Yeah, there's no points for engagement, but please do engage, and please do like and subscribe to our channel. We really, really do appreciate your support.
Yeah, support is very important. We like it. We love it. Thank you, Mummy, for watching.
Alright, never mind. We just decided to make this video a little bit longer with the diagrams and the visuals so you guys don't have to wait any longer. So on this top image right here, I'm just trying to give you guys a little bit of context. The two bones that we talked about. The scapula is the one that is present in the back. So this is like the front view of your body. And the clavicle right here is your collarbone. Now, just talking about the scapula real quick, we see two images of the scapula right here. We have one right scapula with the anterior aspect, that is the forward aspect or the front aspect. And then we have a posterior aspect, that means looking at the scapula from the back. So looking at some features of, let's say, the posterior aspect of the scapula, we talked about the spine of the scapula. So this is this middle, not necessarily middle, a little bit on the superior end. You have the spine of the scapula. That is dividing the scapula into two different fossas. The supraspinous fossa that lies above the spine of the scapula, and then you have the infraspinous fossa that is almost all of this right here below the spine of the fossa. And we also talked about another fossa that is on the anterior aspects. On the anterior aspect, you see this fossa right here, that is the subscapular fossa. So this lies against the ribs. Alright, then you have another fossa that is known as the glenoid fossa that lies on the lateral side of the scapula, which is here, it is shown as a glenoid cavity, but it's on the lateral aspect. Alright, so you can also see it on the anterior aspect. This is your glenoid cavity right here. Okay, so these are the four different fossas. And talking about the three different processes of the scapula, you have the acromion process, you have the coracoid process. As I said, the coracoid process is a little hook-shaped process. You can see both of them here as well. The coracoid process is right there, a little hook shape. The acromion is coming, kind of sneaking out from the back. And the third process is the spinous process, which I'm not sure is labeled. I don't think it's labeled in this diagram, but it lies on the spine of the scapula. Anyway, so we also talked about three different borders, right? So right here, if you look at the posterior aspect, you'll see this side makes up the medial border. The lateral border lies on the lateral side, and the superior aspect, on the superior aspect, you have a superior border. So this would be the superior border on the posterior aspect, and this would be the superior border on the anterior aspect. Now, one more thing that we forgot to mention in the video, but I'll just mention it right here, that a little medial to the coracoid process, you have this suprascapular notch. We'll talk about its purpose later on, but it's just a key landmark to remember in this scapula bone. All right, moving on to the clavicle. This is your right clavicle, and we're just going to see the superior aspect of it. So on the superior aspect, you see that you can see the sternal end. Sternal is the medial end, the one that attaches to the manubrium, the part of the sternum bone. And then you have the acromial end, that is on the lateral side. And on the inferior part, it's not very clear right here because, again, it's on the superior aspect, but you can see a little protuberance that is known as the conoid tubercle. But you can see it better here in the inferior aspect, right? So right here, this is your conoid tubercle. It attaches the coracoclavicular ligament. And here on the shaft, you see a little bit of a groove that is known as the subclavian groove, where the subclavius muscle attaches. And let's see what else we talked about. So we also, again, sternal facet or sternal end, that means the medial side, or the acromial facet, or the lateral side. You also see a little bit of a trapezoid ridge, a little bit lateral to the conoid tubercle, which is another thing that you should keep in mind. But that, yeah, probably that most of it, that sums up all the bones that we talked about, the scapula and the clavicle. Make sure that you put your answer in the comment section below for the question, which bone do you think is more prone to fractures, scapula or clavicle?
Anyways, we're going to end it off now. Like and subscribe. See you guys next video.